Hello everyone, I am Asmaa, lecturer in College of Dentistry, University of Mosul. At the beginning, I and my colleagues are glad to join the 8th International Conference of Biotechnology, Environment and Engineering Sciences in Stockholm, an online event. Our research entitled Antifungal Effectiveness of Different Denture Cleansing Methods. The participant names are Maha Al-Rajabo, Department of Biology, College of Science, University of Mosul; Asmaa Abdulkadir, College of Dentistry, University of Mosul; Omar Abdul Mohsen Sheet, College of Dentistry, University of Mosul. Acrylic glazing is a material that's widely used to construct partial or complete denture. Adhesions of microorganisms and mainly Candida species which present in oral cavity to denture surface can cause accumulation of plaque which lead to serious problems like denture stomatitis in patient mouth. Many cleansing modalities has been found to disinfect dentures such as mechanical method, brushing with denture brush, chemical washing, soaking in commercial denture cleansers, ultrasonic cleansing method, and combination of each. The aims of our study is to compare between the method of denture cleansing used by patients in Mosul city, such as soaking in sodium hypochlorite, soaking in salty solution, use of mechanical brushing, and compare these results with the results of disinfection obtained from immersion in commercially available denture cleanser effervescent tablet called Polygrip. Materials and methods of our research include the preparation of acrylic sample. Firstly, the acrylic sample used in this study were prepared in shape of circular shape samples of 10 mm in diameter and 1.5 mm in thickness. Those samples prepared from hot cured acrylic denture base, and the method is the same as the method used for construction of acrylic denture. The selection and isolation of fungi used in this study need the incorporation of 10 complete denture wearers, 7 males and 3 females, whom visiting prosthodontic clinic in University of Mosul in Mosul city. Those patients suffering from sign and symptom of denture stomatitis. Those patients asked to be participants in our study to obtain oral swab that will be used for isolation of fungi to be studied. The exclusion criteria include use of antifungal or antibiotic in the previous month, the use of steroid-containing drugs in the previous month, and if the patient has a sensitivity to the denture polymer. Swabbing was done from the palate and also from the fitting surface of their dentures. The swab was dipped thoroughly in 1 ml of saline sample and transported immediately to microbiology lab in microbiology in Science College in University of Mosul, where it had been cultured and isolated in a specific technique. The discs divided into 3 main groups according to the type of fungi isolated. Each group will contain 25 discs. Each group were subdivided into 5 subgroups, each group containing 5 discs placed in a sterile plastic box. Groups were made according to the method of cleansing used. First group, which represent the control group, were the 5 discs washed only by sterile distilled water 3 times. The second group, also 5 discs placed in a container containing Polygrip effervescent tablet, which is a sterile material available in pharmacies used to sterilize dentures. Third group, 5 discs were sterilized by using a brush and detergent available at home for 3 minutes. And the fourth group include 5 discs were immersed in food salt solution at a rate of 30% for 12 hours, and the final group, the 5 discs, were immersed in sodium hypochlorite at a rate of 0.25% for 30 minutes only. The results and discussion of our results in this research. The studied fungi was isolated from denture patient had denture-induced stomatitis. The isolated fungi were Candida albicans, Candida parapsilosis, Candida tropicalis, Cryptococcus species, Rhodothrula micheliginosa, and mold, with different ages and the genders of the patient, as listed in this table. After that, the selected fungi used in this study were Candida albicans, Candida parapsilosis, and Rhodothrula micheliginosa only. Now, the results according to the fungi used. First of all, the result of using different denture cleanser on availability of Candida albicans. As you see, all the type of denture cleanser used in Mosul city was effective except the mechanical method, that's to say using a brush and detergent. The commercially available effervescent tablet also was effective when compared with the control group. Now, the results of the denture cleanser modalities used against Candida parapsilosis showed that all the method was effective against this fungi except the immersion in sodium hypochlorite at 30% for 12 hours, and also the commercially available polygrip was effective. Finally, the results of denture cleansers against Rhodothrula micheliginosa showed that all the modalities used besides the commercially available effervescent tablets was effective against this type of fungi. According to that, we can see that the mechanical cleansing by brush and home detergent effective against the all type of fungi studied in this research: Candida albicans, Candida parapsilosis, Candida except Candida albicans. That is mean that the simplest method of cleansing is advantageous, and both dentist and patient should not ignore. This finding agree with recent previous research made by Ghazal et al. And Paranhus et al. The use of unsterile dental brush in home care affect the precise antifungal effect of mechanical denture cleansing method, and the Candida spores also is difficult to be removed and killed completely by this method. Besides that, and although of that, the simplicity, low cost, and effectiveness of mechanical cleansing method make it good advice to denture wearers in Mosul city. The second modality is the use of immersion in salty water at 30% for 12 hours. The antifungal effectiveness of this cleansing method clearly shown against studied fungi except Candida parapsilosis, which increased in growth when compared with other groups. Salty solution is known to be affect the osmolarity of the microbial cell wall, which will result in leakage of cellular content outside the cell and strong shrinkage of the cell, which lead to cell damage. This method of immersion in salty water is heavily used and most popular used by Mosul city popularity or denture wearers. And this point make us to put this method in our mind that it can give good prevention modality against infected fungi. Now, the third method used in this study is the immersion of the sample in sodium hypochlorite at 0.25% for 30 minutes, which give us the best antifungal activity among other modalities and against all the studied fungi. This result makes sterilizing the denture with this method is so beneficial as it suppressed the growth of the fungi. Now, this material, sodium hypochlorite, is a potential material against Candida species, as many studied was concluded, like study made by Pedro et al., Valentini et al., Arruda et al., and Ferreira et al., and many other studies also concluded that this material is potential material against fungi. Besides that, some studies and research study the effect of this material against the property of acrylic resin, and they found that prolonged use of this material, prolonged time use, and increase the concentration of this solution affect the property of the acrylic resin, so that they advise not to stop daily use of this material, and the concentration should be studied in a precise concentration. The final modality used in this study was the immersion of samples in polygrip effervescent tablets, revealed that the denture cleanser is effective against all type of fungi studied. The ingredient of this commercially available denture cleanser, and especially the ingredient that cause effervescent property, this property will start mechanical cleansing to the sample surface. Then prolonged immersion of the samples is enough to cause chemical killing of the fungi by the effect of sodium lauryl sulfosinate. This detergent increase the permeability of the cell wall, lead to cytoplasmic leakage. Now, as conclusion to our study, within the limitation of this study, we concluded that nearly and commonly available patient home care methods among most city patients with his acrylic-based denture is very effective against infectious fungi. Mainly, method use immersion in 0.25% sodium hypochlorite, method use immersion in 30% salty solution, and method use mechanical cleansing by brush and detergent. Commercially available effervescent tablet is also very effective, but its price remained an important limiting factor to be used by poor patients in Mosul city. Thank you for your listening.